Are you ladies ready to huddle?
Yeah.
Okay.
Some add-in spots for the day. We could do a 9:30, 11:30, a 2:15, and a 3:30.
That looks great.
And then I will have our scheduler call the 2 o'clock since Ted chronically misses his appointments.
Okay, thank you.
Okay, our first patient of the day is Sue. She's coming in for an ER follow-up. She was seen within a different system, so we will have to get those records pulled for her.
Okay.
And that A1C that we added onto Mary's labs came back, and her result came back to a 7, so we could do some warm handoff to the RN for some diabetes education.
Okay, great. Give them a heads up about that.
Okay, Jane, she's coming in for some lower back pain. Then we can see if the physical therapist can see her if she's eligible.
Okay.
And then we have Ed coming in. He doesn't have any insurance, so we could possibly do a referral to case management.
Okay, and if she's available, we'll make that a warm handoff.
Okay.
Okay, our last one of the day, Bob, he's coming in for his Medicare visit. He is a candidate for CCM, so we can see if he wants to set that up today. He is our last patient of the day, so we can probably start to see our patients now.
All right, great. And you're going to get that huddle handoff sheet ready for everyone?
Yep, I'll get one to the RN and the scheduler.
All right, thank you.
Morning, ladies.
Good morning.
All right, here's a huddle handoff form for each of you. On here, we have some spots where you can do some add-ins. And then Sharon, if you could call our 2 o'clock Ted, just because he tends to miss his appointments. And then Teresa, we have our 8 o'clock patient. They're going to be a new diabetic, so if you could do some education at the end of the visit. All right, sounds
Great,
good.
thank you.
Thanks. Paige, do you want to go ahead and start visit prep, and I'll go in and do in basket?
Yeah.
Dr. Rachel, I was viewing results, and Mary's glucose came back elevated at 120. I'm going to go ahead and add an A1C.
Oh, perfect. Thank you.
Okay. Looking at our chart prep for the day, Joe is coming in. The only thing it looks like he's due for is his colonoscopy, so we will get that ordered for him today.
Great, and go ahead and schedule it right away too, please.
Bobby Joe's PAP came back normal, so I'll go ahead and message her through the online portal.
Thank you. And Paige, I noticed that Lisa's TSH came back a little bit high. Would you mind sending her a message through the portal that I'd like to increase her levothyroxine to 100 micrograms once a day and repeat that TSH in about 4 to 6 weeks?
All right. We will get that levothyroxine sent over to her pharmacy. I'll get the order put in for that TSH, and we'll message that all to her on the portal.
Thank you.
And on Kathy, we received a prior authorization paperwork for her Vibrid. I called the pharmacy already, and they will do sertraline. Do you want to go ahead and order the sertraline?
She actually failed sertraline, so if you don't mind doing the prior authorization, I'd appreciate that.
Okay, I will do that.
Thank you.
Excuse me, Dr. Rachel, you have a moment?
Yeah.
I have a patient of yours on the phone, Sarah. She's been sick with cough, chest congestion, about 10 days. I was tried over-the-counter medication, not getting better. Now it seems to be settling more in where she's having a hard time catching a deep breath. I'm wondering if you can see her at all today?
I think all of my double booking spots are filled up. Maybe we can check with Eric.
Okay.
Eric, would you have room to fit a patient in your schedule today?
Yeah, I should have room later this afternoon. Is it a patient I've met before?
Yeah, her name is Sarah. You've seen her in the past.
Okay, yeah, I think I know who that is.
What time would work for you?
About 2. I should
Okay.
have an opening at 2. If you can put that in my schedule, that'd be
Perfect.
great.
I will. Thank you.
Okay.
You're
Thanks.
welcome. Also, Dr. Rachel, I have a patient later this afternoon who kind of non-compliant diabetic, having trouble managing her sugars. Would you mind helping me later this afternoon with her?
Sure. Let me know when you want me to pop in the room and we can take a look at her together.
Perfect.
I also have a patient that I'd like to bring you in on later. It's a well-controlled diabetic, and I'd just like to introduce you to the patient and maybe have you do their next follow-up so that if I'm ever out of town, they're comfortable with you taking
Absolutely.
care of them.
Absolutely.
Okay.
Thank you.
Thanks.